If the focus to be a psychiatrist is to make $1 million a year, then you probably should not be a psychiatrist. As a psychiatrist, you're dealing with people who are in vulnerable or stressful situations. They're dealing with anxiety, depression, mood problems. They're in a vulnerable state in their life. And so you can't really use them or exploit them for financial reasons, because it's just going to probably come back to harm you in the end of the day. But if you're going into psychiatry for the right reasons and you want to help with your financial income and your growth, you could have like a large clinic that employs nurse practitioners, physician assistants, therapists. You could do something like that and you could sort of generate revenue that way. Also, there's clinics that really focus on procedures like transcranial magnetic stimulation or TMS, and that can, if you have a lot of patients getting that treatment, that can help with the finances and you can make good money doing that way. There's also clinics like the Amen Clinic. Dr. Amen does brain imaging, that he scans the parts of the brain that could be affected in people with mental health and sort of gives an analysis of how they should treat based on the brain scans. And I'm sure at some points in his career, he may have made $1 million or more. He also does books and speaks and things like that. So I think there's other ways to generate revenue being a psychiatrist, whether it's doing research and getting grants from the government for research, maybe writing books, maybe doing talks for organizations or for pharmaceutical companies. So you can make increased revenue in different avenues. But I think in short, if you want to make $1 million being a psychiatrist, probably shouldn't be a psychiatrist. Most psychiatrists are not going to make $1 million a year, at least not at this time.